121. What type of medication is Montelukast, singular? A. Beta agonist. B. Leukotriene receptor antagonist. C. Corticosteroid. D. Antihistamine. Answer: B. Leukotriene receptor antagonist. Rationale: Montelukast reduces inflammation by blocking leukotrienes, which trigger asthma symptoms. 122. Which environmental factor is most likely to trigger asthma symptoms? A. High humidity. B. Cold and dry air. C. Loud noises. D. Bright lights. Answer: B. Cold and dry air. Rationale: cold and dry air can irritate the airways and lead to asthma flare-ups. 123. What is the recommended way to use a spacer with an inhaler? A. Shake, attach. Inhale slowly. B. Attach, press inhaler. Inhale quickly. C. Shake, attach, hold breath. D. Press inhaler before attaching. Answer: A. Shake, attach. Inhale slowly. Rationale: a spacer helps deliver medication effectively when used with slow, deep inhalation. 124. Which of these is a common side effect of using an albuterol inhaler? A. Increased heart rate. B. Drowsiness. C. Low blood pressure. D. Slow breathing. Answer: A. Increased heart rate. Rationale: albuterol, a bronchodilator, can cause a rapid heartbeat as a side effect. 125. What role does mucus play in asthma? A. Protects the lungs. B. Increases airflow. C. Blocks and narrows airways. D. Helps expand the lungs. Answer: C. Blocks and narrows airways. Rationale: excess mucus production during asthma attacks contributes to airway obstruction. 126. What does bronchoconstriction mean? A. Widening of the airways. B. Narrowing of the airways. C. Increased oxygen intake. D. Decreased mucus production. Answer: B. Narrowing of the airways. Rationale: bronchoconstriction occurs when airway muscles tighten, making breathing difficult. 127. Which type of doctor specializes in treating asthma? A. Cardiologist. B. Pulmonologist. C. Dermatologist. D. Neurologist. Answer: B. Pulmonologist. Rationale: pulmonologists specialize in lung and respiratory conditions, including asthma. 128. How often should someone with well-controlled asthma use a rescue inhaler? A. Multiple times a day. B. Once a week or less. C. Every few hours. D. Before bed every night. Answer: B. Once a week or less. Rationale: frequent use of a rescue inhaler suggests poor asthma control and may require a treatment adjustment. 129. What is the main function of inhaled corticosteroids in asthma treatment? A. Provide immediate relief. B. Reduce inflammation. C. Increase airway mucus. D. Cure asthma. Answer: B. Reduce inflammation. Rationale: inhaled corticosteroids help control asthma by reducing airway inflammation. 130. What is an example of an emergency asthma symptom? A. Slight wheezing. B. Shortness of breath despite medication. C. Occasional cough. D. Runny nose. Answer: B. Shortness of breath despite medication. Rationale: if symptoms persist despite medication, emergency care is needed. 131. How can exercise-induced asthma be prevented? A. Avoiding all physical activity. B. Using a bronchodilator before exercise. C. Taking antibiotics. D. Holding breath. Answer: B. Using a bronchodilator before exercise. Rationale: a bronchodilator helps prevent airway constriction triggered by exercise. 132. Which food is most likely to trigger asthma symptoms? A. Apples. B. Shellfish. C. Bananas. D. Rice. Answer: B. Shellfish. Rationale: shellfish allergies can trigger severe asthma symptoms in sensitive individuals. 133. What is a common trigger of nighttime asthma symptoms? A. Lying flat. B. Drinking warm water. C. Exercising before bed. D. Sleeping in a cold room. Answer. A. Lying flat. Rationale. Lying flat can cause postnasal drip and airway constriction, worsening asthma symptoms. 134. How does exposure to air pollution affect asthma? A. It improves lung function. B. It can worsen symptoms. C. It has no effect. D. It cures asthma. Answer. B. It can worsen symptoms. Rationale. Pollutants can irritate airways, leading to increased asthma attacks. 135. Why is it important to follow an asthma action plan? A. To manage symptoms effectively. B. To eliminate the need for medication. C. To avoid seeing a doctor. D. To cure asthma. Answer. A. To manage symptoms effectively. Rationale. An action plan provides clear steps for symptom management and emergency situations. 136. What happens when someone experiences a severe asthma attack? A. Airways completely open. B. Oxygen levels drop. C. Heart rate slows. D. Airways become permanently damaged. Answer. B. Oxygen levels drop. Rationale. Severe attacks limit airflow, reducing oxygen levels and requiring urgent treatment. 137. What is the most effective way to avoid asthma attacks triggered by dust mites? A. Keeping windows closed. B. Using air conditioning. C. Washing bedding in hot water. D. Wearing thick clothing. Answer. C. Washing bedding in hot water. Rationale. Hot water kills dust mites, reducing exposure to this common asthma trigger. 138. What does status asthmaticus refer to? A. Mild asthma. B. Life-threatening asthma attack. C. Controlled asthma. D. Temporary asthma relief. Answer. B. Life-threatening asthma attack. Rationale. Status asthmaticus is a severe, prolonged asthma attack requiring emergency treatment. 139. Why should asthma patients avoid aspirin if they have aspirin-induced asthma? A. It increases mucus production. B. It can trigger severe attacks. C. It lowers blood pressure. D. It causes drowsiness. Answer. B. It can trigger severe attacks. Rationale. Some individuals with asthma are sensitive to aspirin, which can cause dangerous reactions. 140. Which of the following is a non-medication way to improve asthma control? A. Avoiding triggers. B. Ignoring symptoms. C. Smoking in moderation. D. Drinking cold drinks. Answer. A. Avoiding triggers. Rationale. Identifying and avoiding asthma triggers is key to managing the condition effectively. 141. What is the function of peak flow monitoring in asthma management? A. Measures blood oxygen levels. B. Measures lung function. C. Monitors heart rate. D. Detects allergies. Answer. B. Measures lung function. Rationale. Peak flow meters help track lung function and detect early signs of worsening asthma. 142. What is a common symptom of an asthma flare-up? A. Fever. B. Runny nose. C. Wheezing. D. High blood pressure. Answer. C. Wheezing. Rationale. Wheezing occurs due to narrowed airways during an asthma flare-up. 143. Which part of the respiratory system is primarily affected by asthma? A. Lungs. B. Trachea. C. Sinuses. D. Diaphragm. Answer. A. Lungs. Rationale. Asthma affects the airways inside the lungs, causing inflammation and difficulty breathing. 144. What is the primary goal of asthma treatment? A. Cure the disease. B. Reduce symptoms and prevent attacks. C. Make breathing difficult. D. Increase mucus production. Answer. B. Reduce symptoms and prevent attacks. Rationale. Asthma treatment aims to control inflammation and prevent flare-ups. 145. What should an asthma patient do if their quick relief inhaler does not work? A. Wait and try again later. B. Call emergency services. C. Drink water. D. Lie down and rest. Answer. B. Call emergency services. Rationale: if a rescue inhaler fails, it may be a severe attack requiring immediate medical help. 146. Which lifestyle habit can worsen asthma symptoms? A. Regular exercise. B. Smoking. C. Healthy eating. D. Sleeping early. Answer: B. Smoking. Rationale: smoking irritates the lungs and worsens asthma symptoms. 147. What type of medication is salmeterol? A. Short-acting beta agonist. B. Long-acting beta agonist. C. Antihistamine. D. Steroid pill. Answer: B. Long-acting beta agonist. Rationale: salmeterol is a long-acting bronchodilator used for long-term asthma control. 148. What is the purpose of an asthma action plan? A. To guide asthma management. B. To track medications only. C. To prevent all allergies. D. To replace medical treatment. Answer: A. To guide asthma management. Rationale: an asthma action plan outlines treatment steps and emergency actions. 149. Which weather condition is most likely to trigger asthma symptoms? A. Warm and humid. B. Cold and dry. C. Rainy. D. Windy. Answer: B. Cold and dry. Rationale: cold and dry air can cause airway constriction, worsening asthma symptoms. 150. Which household pet is least likely to trigger asthma symptoms? A. Cat. B. Dog. C. Fish. D. Rabbit. Answer: C. Fish. Rationale: fish do not produce dander, making them a safer pet choice for asthma sufferers. 151. How does stress impact asthma? A. It improves lung function. B. It can trigger symptoms. C. It has no effect. D. It cures asthma. Answer: B. It can trigger symptoms. Rationale: stress can cause airway constriction and worsen asthma attacks. 152. What type of inhaler is used daily to prevent asthma symptoms? A. Rescue inhaler. B. Maintenance inhaler. C. Herbal inhaler. D. Emergency inhaler. Answer: B. Maintenance inhaler. Rationale: maintenance inhalers contain corticosteroids to prevent symptoms before they occur. 153. What should be avoided by someone with exercise-induced asthma? A. Running in cold air. B. Drinking water before exercise. C. Stretching before exercise. D. Wearing warm clothes. Answer: A. Running in cold air. Rationale: cold air can trigger bronchoconstriction, leading to an asthma attack. 154. What is a bronchodilator used for? A. Reducing airway inflammation. B. Opening the airways. C. Increasing mucus production. D. Curing asthma. Answer: B. Opening the airways. Rationale: bronchodilators relax airway muscles, making breathing easier. 155. Why is it important to rinse the mouth after using an inhaled corticosteroid? A. To reduce throat irritation. B. To prevent oral infections. C. To improve taste. D. To increase absorption. Answer: B. To prevent oral infections. Rationale: rinsing prevents oral thrush, a common side effect of inhaled steroids. 156. What is the function of leukotriene receptor antagonists like montelukast? A. Open the airways. B. Reduce inflammation. C. Increase lung capacity. D. Cure asthma. Answer: B. Reduce inflammation. Rationale: leukotriene receptor antagonists reduce airway inflammation and swelling. 157. What is the first step in treating an asthma attack? A. Use a rescue inhaler. B. Drink cold water. C. Take a long walk. D. Lie down flat. Answer: A. Use a rescue inhaler. Rationale: a rescue inhaler provides quick relief by opening the airways. 158. Which of the following is a sign of well-controlled asthma? A. No nighttime symptoms. B. Frequent inhaler use. C. Shortness of breath daily. D. Regular hospital visits. Answer: A. No nighttime symptoms. Rationale: Well-controlled asthma means minimal symptoms, including at night. 159. Why should asthma patients avoid exposure to mold? A. It strengthens the immune system. B. It can trigger symptoms. C. It improves lung function. D. It has no effect. Answer. B. It can trigger symptoms. Rationale. Mold spores can irritate the airways, causing asthma attacks. 160. What is an early warning sign of worsening asthma? A. Increased mucus production. B. Frequent coughing. C. Increased appetite. D. Weight loss. Answer. B. Frequent coughing. Rationale. Frequent coughing, especially at night, can indicate worsening asthma.